Hi, have you heard about antibiotic resistance? If no, then join me. Let's delve into the world of antibiotic resistance. First of all, let's get to know what an antibiotic is. An antibiotic is a medication or a drug that is used to treat and prevent infections caused by a bacteria. Bear in mind that antibiotics fall under a bigger group of medications we call the antimicrobials. The antimicrobials are made up of the antibiotics, the antifungals, the antivirals, and the antiparasites. Now, let's talk about the bacteria itself. Bacteria can cause infections, but at the same time, it's very useful for our body. Every human being has a number of bacteria within their body, especially in the gut, that is the digestive tract, which one way or the other helps in digestion and also help to keep the microorganisms in our body in check. Now let's talk about the antibiotic resistance. When we say antibiotic resistance, it simply means that the antibiotics that are made to kill or stop the growth of the bacteria is failing to work. And why is it failing to work? Because the bacteria has changed its response to the antibiotic, rendering it ineffective. That is what we refer to as the antibiotic resistance. Take note that antibiotic resistance is one of the leading threats affecting global health, development, and food security in current times. Because of that, antibiotic resistance is considered as a silent pandemic because it's everywhere in the world. It is in Africa, it is in America, it is in Asia, it is everywhere basically. Because of that, antibiotic resistance is considered a silent pandemic. Someone will ask, if I'm young, can antibiotic resistance pose a threat to me? And someone will also ask, what if I am an elderly? Would I be at a risk of antibiotic resistance? Yes, for both groups. Antibiotic resistance affects anyone at any age, at anywhere. It doesn't matter where you are. It doesn't matter how old you are. And it doesn't matter what your age is. Then someone will ask, how does antibiotic resistance come about? Antibiotic resistance may occur naturally, but antibiotic misuse and antibiotic overuse are the greatest contributors to antibiotic resistance. Now let's answer the question, what are the causes of antibiotic resistance? Number one, we are looking at misuse of antibiotics. You have Kojo, who when any small feeling of discomfort, headache, feeling hot, he's running to the drugstore to buy amoxicillin. That is a misuse of an antibiotic. Antibiotics should only be given when necessary and when indicated by a healthcare practitioner. Overuse of antibiotic is another cause of antibiotic resistance. You were prescribed antibiotic for a particular reason. You finish taking it, the following month you develop some discomfort, some illness, and you think that that is going to be the way to go. You went to buy the antibiotics and you are abusing it. You are using it, thinking that it would solve the predicament you currently have. My brother, you are doing the wrong thing. That is an overuse of antibiotics and is a cause of the antibiotic resistance. Another cause is spontaneous resistance. This means that the bacteria over time can spontaneously undergo a change in its DNA. We term that as mutation. And when that happens, the bacteria is able to change in response to the antibiotics. It will resist the ability of the antibiotic to kill it or to prevent its growth. Another cause is the use of antibiotics in agriculture. Antibiotics has been used in the agriculture sector, especially for the treatment of infections in animals. So with that, these bacterial infections tend to develop resistance to the antibiotics from there. Then the next one is when it's as a result of transmission. We call that transmitted resistance, meaning that someone acquired a bacterial infection and developed resistance to the antibiotic that he or she was abusing and misusing, then transmits that same bacteria with an already existing resistance to another individual. We call that transmitted resistance. So those are the causes of antibiotic resistance. Again, someone may ask, can antibiotic resistance be treated? Not entirely. If an infection which is caused by a bacteria is resistant to one particular antibiotic, then your healthcare provider may change the antibiotic to another one with the hope that that particular one may work against this bacterial infection. But it will come at a cost, meaning that there could be side effects arising from the new antibiotic purported to solve the problem of antibiotic resistance. So that is it. It is not 100% surety. Then again, someone will ask, can antibiotic resistance be prevented? The question is answered. The answer is yes. How can antibiotic resistance be prevented? So let's look at some of the ways by which antibiotic resistance can be prevented. The first one is you should always follow your doctor's advice on treatment. Sometimes you go to the hospital or the clinic, you have been seen by the doctor and the doctor is advising you on lifestyle modification without giving you medications. There you see the individual, the patient getting angry. Why are you not giving me antibiotic? These are some of the reasons why there will be antibiotic resistance. Your doctor will only give you antibiotics if there is actually a need for the antibiotic. So follow your doctor's advice on the treatment of infections. Second one is make sure to stick to the treatment regimen. It doesn't mean that when you are sick and you are given antibiotics, you take it for 2 days, you start feeling well and you stop taking the medication. No, because feeling well does not mean that the bacteria is dead or the bacteria has been killed. Stopping the medication may create a good environment for the bacteria which is getting weakened to have a resurgence, and that could lead to the development of antibiotic resistance. Another way to prevent antibiotic resistance is to take your own medications that are prescribed to you by the healthcare practitioner. Do not go and take somebody else's medication. For example, you have Kofi who was ill 3 months ago and was prescribed antibiotics. He took it, he got better. You got ill, and since you saw Kofi also getting ill and taking that antibiotics and getting better, you decided to go for his medication. That is absolutely wrong, and that could pose a threat known as what? Antibiotic resistance. The next way to prevent antibiotic resistance is do not forget to take your medications. For example, you have been prescribed antibiotics and you missed a dose. What do? You have to reach out to your healthcare provider, the doctor, to know the next step to take. And to prevent forgetting taking the medication, you have a smartphone. What do you have to do? Just set an alarm to indicate the time to take the antibiotics, and that could help prevent you from missing a dose of the antibiotic. Good health practices such as regular hand washing, proper food hygiene, practicing of safer sex, because without you contracting diseases, you will not need antibiotics. So practicing safer sex will prevent the risks of what? Acquiring diseases. And that in its own way will reduce the need for antibiotics. Then finally, vaccinations may be of help. If you are vaccinated against a particular disease, then your risk of getting that disease becomes reduced. So those are the ways by which antibiotic resistance can be prevented. Then another question will arise. Are there complications of antibiotic resistance? Yes, there are complications. And what are these complications? If you are taking an antibiotic which has been prescribed to you by a doctor and it's not working, then it means that infections that you could have treated at home, you would definitely need an admission to be treated. So with that, we'll say that antibiotics tends to prolong hospital stay. It tends to prolong hospital admission, and by so doing, it would increase the cost of medical care. Another complication is that it increases mortality. It means that the chances of you becoming severely ill and die from that infection would rise. And also, since new medications will have to be prescribed, there is a likelihood that there could be severe side effects from that new medication that would be prescribed. So those are the complications of antibiotic resistance. Then finally, someone will ask, if I develop resistance, if I develop antibiotic resistance to a particular antibiotic resistance and I have been prescribed another antibiotic and still the infection caused by the bacteria still persists, what could be the cause? The answer to that question is that there are certain bacteria that will resist and stand against variety of antibiotics that will be prescribed for a particular patient. They would develop and replicate and grow in spite of treatment with various antibiotic medications. We refer to those bacteria as superbugs. Examples: the bacteria that causes tuberculosis, that's Mycobacterium tuberculosis; Staphylococcus aureus, specifically the methicillin-resistant Staphylococcus aureus; the Clostridium difficile; then finally gonorrhea. These bacteria are termed as superbug because they are able to grow and multiply in spite of the variety of antibiotics used to treat them, to kill them, to stop their growth. They still grow and multiply. We call them a superbug. So that answers the question. But before we come to a conclusion on antibiotic resistance, it will be imperative to give credence to those who contributed to the development and the production of antibiotics. The first scientist who worked on antibiotic is by name Alexander Fleming, and his work in 1928 resulted in the discovery of the antibiotic known as penicillin. Then finally, the father of antibiotics, Selman Waxman, a Ukrainian-American scientist whose work resulted in the development and production of more than 20 antibiotics. Let's give a clap offering to that man. He did a great job by helping in the discovery of several antibiotics. So in a nutshell, antibiotic resistance is currently being considered as a silent pandemic because it takes time for your healthcare provider to discover that you have antibiotic resistance. Then you may be asking, who are those having the greatest risk for antibiotic resistance? The answer to that question is that those with immunodeficiency. And who are those? Immunodeficiency or immunosuppressions. Who are those? Those with HIV, those living with HIV, those having autoimmune conditions such as lupus, those who are being treated for cancer, and also the elderly people. Because their immune system is weak, they tend to have the greatest risk for antibiotic resistance. Not forgetting those who are misuse and overuse antibiotics. So in a nutshell, that is antibiotic resistance. Do you think antibiotic resistance is a potential threat to our development as a world? Leave your comments in the commentary section. My name is Dr. Del, and this is Concept in Medicine. Bye-bye.